Our topic that we're going to be presenting to you guys today is issues in long-term nursing care. My name is Jessica, and I did this project with my friend Devin. And when we were working on this project, we both did about 50-50. We were able to meet for basically all of the times we worked on this project, with researching the topic, writing the paper, and eventually putting together this PowerPoint presentation.
Our learning objectives for this topic would be to identify 3 issues patients face in long-term nursing care, describe the causes of pressure ulcers and malnutrition, explain how depression and anxiety are linked to long-term care, apply these concepts to the nursing practice, discover ways to prevent these issues that develop from long-term nursing care.
Long-term nursing care is often a topic of neglect. And the problem with that is that it is a topic that will always be a need in the nursing world, because there will always be elderly people who need nursing care and a place to stay for that care, as long as patients with chronic illnesses that need care. We found that 28% of patients in long-term care suffer from a pressure ulcer because they are in a prolonged immobility state. We found that 37% of people present with depression in this long-term care, as well as 40% lacking morning care, which is a very unfortunate statistic. Malnutrition is also common because these people are frail elderly that are not able to ingest the nutrition that they need, and that can also lead to other issues in the long term. And our thesis statement is, while many people view long-term care to be helpful to their patients and families, problems arise from the prolonged care, including physical issues and psychological problems.
Our nursing theorist is Hildegard E. Peplau. She was born in Pennsylvania in 1909. In her later years, she received her BA in interpersonal psychology at Bennington College. In 1947, she attended Columbia University, where she finished her master's in psychiatric nursing. She became famous for what she calls Peplau's theory, or psychodynamic nursing, which is the understanding of one's own behavior. The part of her therapy that relates to long-term nursing care includes the theory that nursing is an interpersonal process because it involves interaction between 2 or more individuals with a common goal. In long-term care, it is vital that the nurse and patients work together along with the family to find common ground in the patient's plan of care. Her list of roles a nurse plays in the care of a patient's life also applies to the topic of long-term care. Nursing roles include stranger, teacher, resource person, counselor, surrogate, leader, socializing agent, safety agent, mediator, and health teacher. These roles play a huge part in nursing care, and that a patient builds rapport with that nurse.
When working on this project and paper, we researched articles and journals that included the information about long-term nursing care and the issues that came with it. We tried to find articles and journals that were published between 2012 and 2017, and those that were not within the 5-year time frame we tried to mark as historical evidence. Our searches were conducted through NCBI, which is the National Center of Biotechnology Information, PMC, which is PubMed Central, and the McKee Library's Advanced Search, which is available through the Southern website. Our terms that we used to search for these topics included issues in long-term care, mental issues in long-term care, pressure ulcers in long-term care, nutritional issues in long-term care, and nursing responsibilities in long-term care. The articles and journals that we found for this topic were reviewed for accuracy, relevance, and within the time of the 5 years.
So our first topic that we found was about pressure ulcers and the risks that go along with it. Most medical professionals understand the reasoning behind turning a patient every 2 hours. This practice aids in preventing patients from developing a pressure ulcer, but in long-term care, this risk increases due to prolonged immobility. When a patient's bed comes in contact with a bony prominence or pressure point, the patient's own body weight causes an ulcer to form. bed sores can develop within 2 hours. This fact has been quite surprising in medical personnel and nursing home staff across the United States. The risk factors that increase the likelihood of a patient developing a pressure ulcer include impaired mobility, low BMI, malnutrition, decreased oxygenation and perfusion, increased age, body temperature, friction and shear, skin moisture, pain, drugs, impaired cognition, and sensory perception. Generally speaking, those who are patients in long-term care are usually the elderly. Taking a glance at an elderly person and figuring out what usually is seen is a frail body, a person who has difficulty walking, thin skin, heat, cold intolerance, and many are prescribed multiple medications. As mentioned earlier, all of these characteristics of an elderly person increase the risk of a pressure ulcer. Pressure ulcers also can range in severity, level 1 being redness of a certain area to level 4 being exposed muscle or bone. Pressure ulcers of stage 2 or higher will cost the long-term care facilities no less than $16,000 per patient and will usually require an additional 8 days of hospital care due to the nature of the injury.
Nutritional decline was the second topic that we saw as an issue in long-term care. In these facilities, frail elderly tend to not get the adequate amount of food to meet their energy requirements. And this low energy intake results in malnutrition often. These malnourished patients begin to waste both fat and lean mass, causing body cells to deplete extracellular mass, which includes plasma and water. So coincidentally, this leads to further complications and dehydration. Fluid intake and hydration status affects a patient's body weight. Dehydration status is determined by the patient's BMI, which is body mass index. A patient with a low BMI may indicate a false hydration status, while they actually need to be more hydrated. Unfortunately, dehydration and malnutrition tend to go hand in hand.
Psychosocial challenges is the last issue that we came across in long-term health care, and residents staying in long-term care facilities face issues with their mental health. 2/3 of the long-term health care facilities patients exhibit mental and behavioral problems. Unfortunately, less than 3% of these problems are addressed by medical personnel in the facilities. Some of these behavioral concerns include fear, distress, anger, and stress. These concerns can play a role in immune and cardiac dysfunction, infection, pain, asthma, and prolong the recovery from surgical procedures. If these healthcare issues are not addressed, it can lead to more serious psychosocial disorders such as depression and suicide attempts. 37% of all nursing home residents suffer from depression, which is the main precursor of suicide.
The topic of long-term care facilities in relation to a patient's well-being can easily be implicated in a nurse's life. Nurses have opportunity to educate patients and family members about the risks and prevention methods of pressure ulcers, malnutrition, and depression while residing in long-term care facilities. YAP 2016 notes that education and training is extremely beneficial when it comes to implementing an intervention plan in order to prevent pressure ulcers. In addition to this, it was noted during their study that the elderly's intake of nutritional foods declined even further, according to Strutzel 2016. It is important as nurses to educate other medical personnel in order to raise awareness of the malnutrition issue of long-term care. Lastly, education and awareness of mental health and behavioral issues along with depression is extremely important among the nurse world. The elderly population has the highest rate of depression and suicide in the country. As nurses, this fact is crucial to keep in mind as assessments are made and interventions are done.
The next step to take when assessing the problem patients face with long-term nursing care is applying the information to the nursing practice. Pressure ulcers are almost always preventable, though it does not mean they are easy to prevent. Simply lying in bed for a prolonged period of time can cause skin breakdown, and unfortunately, patients are neglected during their morning care. Simmons noted that during their observation, 40% of residents lacked their morning routine during a 4-hour period. It is suggested that a patient should be turned every 2 hours when immobile in a hospital bed. Without this applied, the patient remains at risk for developing an ulcer. Strutzel wrote that it is important to find ways to feed the elderly with poor oral intake and poor nutritional absorption, high energy, nutritionally dense food. In addition to this, Thomas explained that identifying favorite foods, assisting during meal times, giving nutritional supplements, and even exercise can increase dietary intake. Growing explained that the need of gyrophysiologists is great. They work with the older adults in many different care settings, including community, hospital, and home visits. As nurses, we must advocate for our patients by contacting case management and others in the hospital settings to allow our patients to receive the best care.
Long-term care is a topic that would be very beneficial to future research. A shocking 150,000 of residents or patients will have a pressure ulcer at one point in the United States. More research on how to further prevent these sores from developing and ways to allow healing in a more effective way could be used in the medical world. Thomas mentions that involuntary weight loss is a concern among the elderly. Severe malnutrition in this population often leads to an increased risk for other complications and chronic illnesses. Further research could assist in finding ways to intervene with malnutrition, but better yet, prevent it from happening in the first place. Growing 2017 mentioned that of the elderly adults that commit suicide, 3/4 of them had seen their physician within the last month. This fact alone could encourage more research done on how to prevent elderly from committing suicide and treating their depression.
In conclusion, research has shown that long-term nursing care can be detrimental to the resident's health and including both physical and psychological problems. Patients may form pressure ulcers, become malnourished, and develop depression or anxiety. Prolonged hospital care is one of the many risk factors that may cause a development of an ulcer. In these long-term facilities, the frail elderly patient is not consuming enough nutrients to receive their energy requirements, which can ultimately lead to malnutrition. Prolonged care and physical decline can lead to psychological disorders including depression and suicidal ideation. Most of these issues can be prevented if they are caught early and treated well. Pressure sores can be prevented by adequate turning, hydration, nutrition, and by decreasing friction and shear. Malnutrition can be prevented by catching oral decline early and supplementing as needed. Suicide can be prevented by catching depression signs early and collaborating with family members to get the resident's psychological support. Long-term health care is a significant topic in the nursing world because it will always be around. People grow older, physical health declines, and long-term care is needed. By understanding the risks that increase with the prolonged care, it better prepares nurses to help decrease the prevalence or prevent these issues from occurring.